Hi, this is Savannah Pogue, and this is going to be my practical video for the spine. We are first going to start off with the muscles, then move on to the pathologies, and lastly to the special test. I hope you enjoy. Okay, so starting off with the muscles, the first one is going to be rectus abdominis, and the A is going to be flex the vertebral column and tilt the pelvis posteriorly. Now for the O, it's going to be the pubic crest and pubis symphysis, and for the I, it's going to be the cartilage of the 5th, 6th, and 7th ribs and exovoid process. Okay, the next muscle is going to be transverse abdominis, and A is going to be compress the abdominal contents. O is going to be lateral inguinal ligament, iliac crest, thoracolumbar fascia, and internal surface of the lower 6 ribs. Now the I is going to be rectus shelf to the linea alba. The next muscle is going to be quadratus lumborum. So A is going to be laterally tilt the pelvis and laterally flex the vertebral column to the same side. Then you're going to fix the last rib during the forceful inhalation and exhalation, assist to extend the vertebral column. The O is going to be posterior iliac crest, and I is going to be the last rib and transverse process of 1st through the 4th lumbar vertebrae. Okay, the next muscle is going to be the external oblique. The A is going to be laterally flex the vertebral column to the same side, rotate the vertebral column to the opposite side. You're going to flex the vertebral column, compress abdominal contents. The O is going to be external surfaces of the 5th through the 12th ribs, and the I is going to be the anterior part of the iliac crest, rectus shelf to the linea alba. Next muscle is going to be the internal oblique. So the A is going to be laterally flex the vertebral column to the same side, rotate the vertebral column to the same side. Flex the vertebral column and compress the abdominal contents. The O is going to be the lateral inguinal ligament, iliac crest, and the thoracolumbar fascia. The I is going to be the internal surface of the lower 3 ribs, rectus shelf to the linea alba. The next muscle is going to be the iliocostalis. The A is going to be laterally flex the vertebrae column to the same side, and you're going to extend the vertebral column. The O is common tendon laborum, posterior surface of ribs 1 through 12. Now the I is going to be the transverse process of the lumbar vertebra and 1st through 3rd posterior surface of ribs 6 through 12. Posterior surface of ribs 1 through 6, and the transverse process of the lower cervicals. The next muscle is going to be spinalis. For the A, we are going to laterally flex the vertebral column to the same side and extend the vertebral column. The O is going to be the spinosa process of the upper lumbar and lower thoracic vertebrae, ligamentum muscle, nuchae, and spinosus process of C7. The I is going to be the spinosus process of the upper thoracic and the spinosus process of cervicals except C1. Okay, the next pathology we are going to be talking about is scoliosis. Now, scoliosis is a lateral curvature of the spine that can occur during growth spurts in adolescence or as a result of conditions such as muscular dystrophy or cerebral palsy. Now, the mechanism of injury involves an imbalance in the muscles and ligaments that support the spine, leading to abnormal spine alignment and curvature over time, and there is no special test for scoliosis. Okay, the next pathology I'm going to be talking about is lordosis. It is an excessive inward curvature of the lumbar spine, often referred to as sway back, which can lead to discomfort and postural issues. The mechanism of injury typically involves factors such as obesity, poor posture, or muscle imbalances that place additional stress on the lower back, causing the spine to curve more than normal, and there's no special test for lordosis. The next pathology is kyphosis. Now, this is an abnormal forward curvature in the upper spine, resulting in a hunchback appearance, which can lead to discomfort and respiratory issues. The mechanism of injury often involves factors such as degenerative diseases, osteoporosis, or poor posture, which weaken the vertebrae and cause them to compress or collapse, leading to the characteristic of curvatory. And there is no special test for kyphosis. The next pathology I'm going to be talking about is going to be sprains. Now, a sprain in the back or spine refers to an injury to the ligaments that supports the vertebrae, often resulting in pain, swelling, and restricted movement. Now, the mechanism of injury usually involves sudden movement, such as twisting, lifting heavy objects improperly, which can overstretch or even tear the ligaments in the spinal region. And for sprains, there is no special test to perform. Now, the next pathology I'm going to be talking about is going to be a spinal strain. Now, spinal strain refers to an injury to the muscles or tendons in the back. Now, this results in a lot of pain, stiffness, and even restricted range of motion. So the mechanism of injury often involves overextension, awkward movements, lifting heavy objects improperly, or just too much of an heavy object, and it can stretch the muscles, and it can cause the muscles or tendons to stretch or even tear. And for spinal strains, there is no special test. The next pathology I'm going to be talking about is the facet joint dysfunction. Now, this refers to pain and discomfort arising from facet joints, now which are small joints located between the vertebrae and the spine, often leading to stiffness and limited range of motion. The mechanism of injury typically involves degeneration due to aging, repetitive stress, or trauma, which can cause inflammation, misalignment, or irritation of the facet joints. Now, the special test that is going to go with this pathology is going to be the spring test. The next pathology I'm going to be talking about is compression fractures. Now, these are injuries to the vertebrae in the spine where the bone collapses or is compressed. Now, it is often resulting in pain, deformity, and reduced height. The mechanism of injury commonly involves osteoporosis, which weakens the bones, or trauma falls from accidents that exert excessive force on the vertebrae, leading to their collapse. And for the compression fractures, there is no special test. The next pathology I'm going to be talking about is spinal osteoporosis. Now, it is a condition characterized by the weakening and thinning of bones in the spine. Now, this is making them more susceptible to fractures and deformities. The mechanism of injury involves a decrease in bone density due to factors such as aging, hormonal changes, nutrient deficiencies, or lack of physical activity. These compromise the structural integrity of the vertebrae, and for spinal osteoporosis, there is no special test to perform. The next pathology I'm going to be talking about is the intervertebral disc herniation, and this occurs when the softer inner material of spinal disc protrudes through a tear in the tougher outer layer, potentially causing nearby nerves and causing pain, numbness, or weakness. The mechanism of injury often involves excessive strain or trauma to the spine, such as heavy lifting, twisting motions, or age-related degeneration, which can lead to the disc's outer layer weakening and allowing the inner material to bulge or rupture. Now, there are two special tests that can be used for the intervertebral disc herniation, and it's going to be the Valsalva maneuver or the Wells straight leg raise. The next pathology I'm going to be talking about is the nerve root impingement. This occurs when a nerve root exiting the spinal column is compressed or irritated, leading to symptoms such as pain, tingling, weakness in the areas served by that nerve. The mechanism of injury often involves conditions like herniated discs, spinal stenosis, or bone spurs that encroach on the space where the nerve roots exit the spine, causing pressure and inflammation. Now, there are 4 tests that can be used for the nerve root impingement, and these 4 are the Valsalva maneuver, straight leg raise, the quadrant test, and the stork standing test. The last pathology I'm going to be talking about is sciatica. This is a condition characterized by pain that radiates along the back of the sciatic nerve, which runs from the lower back through the hips and down each leg, often accompanied by numbness or weakness. Now, the mechanism of injury typically involves compression or irritation of the sciatic nerve, commonly due to herniated discs, spinal stenosis, or muscle spasms in the lower back or buttocks. And the special test to go with this is going to be the straight leg raise. Now we're going to start with special test, and the special test we're going to be performing is the Valsalva maneuver. So here's my patient, and I'm going to ask you to make a fist with your hand, and you're going to take a deep breath and blow into your hand, but don't let any air come out. Now, a positive for this test would be increased spinal pain in the lower back or radiating pain down the leg. And the 2 pathologies that are going to go with this special test is going to be the invertebral disc herniation and nerve root impingement. The next special test I'm going to be performing is the straight leg raise. So I'm going to ask my patient, can you lay supine, please? Okay. Now, which leg is hurt?
My right leg.
Okay. You're going to lift up your leg and tell me when you feel pain or a stretch.
Right there.
Okay. And which leg are you feeling pain in?
The one you're lifting up.
Okay. So this is going to be a positive test because the symptoms are on the same side that the leg is being raised. The symptoms would be tingling down the leg or feeling just pain or any type of stretch. And the 2 pathologies that go with this special test are the nerve root impingement and sciatica. The next special test I'm going to be performing is the Wells straight leg raise. So I'm going to have my patient lay supine. And you're going to tell me when you feel discomfort.
Right there.
Okay. And are you feeling pain in your right leg or your left leg?
This leg, the left leg.
Okay. So this would be a positive test because the symptoms are going down the opposite leg that is being raised. Now, some of the symptoms might be a tingling feeling, a pain, or any type of stretched down the leg. And the pathology that goes with this special test is disc herniation. The next special test I'm going to be performing is the spring test. I'm going to ask my patient to lay prone or on their stomach. And is it okay if I touch you?
Yeah.
Okay. So I am going to find your hips, and I'm going to apply pressure on your vertebrae. And the point of this test is to make sure that there is not restricted range of motion or pain or stiffness. And if there is any of that, then it would be a positive test. And the pathology with this special test would be the faucet joint dysfunction. The next special test I'm going to be performing is the quadrant test. Now, I'm going to have my patient stand up and have their feet shoulder width apart. And you're going to have your hands on your hips. And I'm going to hold on to my patient's shoulders and have him lean back and twist to the side that has pain. Perfect. So if my patient has radiating pain, the pathology is going to be nerve root impingement, and a positive test would be shooting, burning, or tingling pain that follows a certain nerve pathway, so the pain would not just be in one spot. Now, if my patient has local pain, the pathology would be a faucet joint dysfunction, and a positive test for that would be sharp aching or throbbing pain that can be pinpointed by the patient. The last special test that I'm going to be performing is going to be the stork test. So I'm going to have my patient stand up, and I'm going to have them face in front of me. They're going to have their body weight evenly distributed. They're going to pick up one leg and have their knee and their hip in flexion. And at a 90-degree angle, their hands are going to be on their hips. I'm going to have my hands on their shoulders. They're going to lean back to hyperextend their torso. And A positive test would be pain in the lumbar spine, and if it's radiating pain, the pathology is going to be nerve root impingement, and if it's localized pain, it's going to be the facet joint dysfunction.